Today, we're going to dive into something pretty amazing, a place where an ancient practice meets cutting-edge neurology. We're talking about hijama, or cupping, but probably not in the way you thought about it before. We're looking at a very specific scientific methodology developed by Dr. Ali Al-Jamal, aimed squarely at treating neurological disorders.
So picture this. You're dealing with awful headaches, constant brain fog, maybe even dizziness. You know something is wrong, but you go get an MRI and the results come back completely normal. The doctors can't see any damage, no tumor, nothing. It's incredibly frustrating, right? So what on earth is going on?
All right, let's get into it. The key to solving this modern medical mystery is understanding the difference between a problem you can see on a scan and a problem with how the brain is actually functioning.
See, on one side you have structural problems. Think of a tumor or a lesion or some kind of physical damage to the brain tissue. An MRI is brilliant at spotting those. But then, on the other side, you have functional disorders. This is where the brain's hardware, its physical structure, is perfectly fine. But the system, the way it all works together, is out of whack. And it turns out that for a lot of these mysterious neurological issues, the problem isn't the brain cells themselves. No, the problem is with the brain's incredibly complex system for managing all of its fluids, pressure, and waste.
To really get this, we need to take a look at what you might call the brain's hidden plumbing. It's this whole sophisticated network that's working 24/7 to keep the brain's internal environment clean and stable.
An easy way to think about it is like a city's drainage system. The brain has these major veins and sinuses that act like big canals. Their job is to collect all the used fluids and waste products and carry them away. Now you can imagine what happens if those canals get clogged up, right? The whole city starts to have problems.
And this system has a few major players. You've got the superior sagittal sinus, which runs right along the top of your head, kind of like a main highway for draining blood and cerebral spinal fluid. Then there's the cavernous sinus, which sits deep behind the eyes. And finally, the transverse and sigmoid sinuses are like the main exit ramps, getting everything out of the skull.
Now, here's a really cool part of this puzzle that scientists have only discovered recently. It's called the glymphatic system. You can think of it as the brain's overnight cleaning crew. While you're asleep, this system flushes out all the metabolic junk that builds up during the day. But, and this is a huge but, for the cleaning crew to do its job, those main drainage canals we just talked about have to be clear.
And here is the absolute kicker. Unlike the veins in your legs that have little one-way valves to keep blood from flowing backward, the brain's entire drainage system has no valves. None. And that makes it super sensitive to any kind of blockage or pressure change. Fluid can back up really, really easily.
So when things do start to back up, it's not just a simple clog. It actually kicks off this nasty, self-perpetuating, vicious cycle that just gets worse and worse over time. Let's walk through how that happens.
Okay, so it starts with what's called venous congestion. Basically, the drainage slows down. This immediately leads to an increase in pressure inside your skull. That pressure puts stress on the brainstem, which messes with your autonomic nervous system, the system that controls things like blood vessel constriction. Well, that disruption causes the veins to tighten up even more, which, you guessed it, makes the original congestion worse, and the whole cycle just keeps spiraling.
This physical traffic jam creates a chemical one too. When the drainage is bad, all this neurotoxic gunk, things like excess glutamate and inflammatory molecules, starts to build up. This chemical stagnation is what you actually feel. It's what's directly causing those symptoms like headaches, fatigue, and brain fog.
So the big question is, how do you break this cycle? Well, this is where the methodology reimagines the traditional practice of hijama as a very precise, very targeted physiological intervention designed to do exactly that.
The scientific term for this approach is targeted negative pressure therapy. The core idea is simple but powerful. Apply suction, or negative pressure, to very specific points on the scalp and neck that are located right over those key drainage pathways. This is not random cupping. It's an anatomically guided strategy to get the brain's fluid dynamics back in order.
So how does it actually work? Well, applying that suction creates a pressure difference. It literally pulls the stagnant fluid from those deep, clogged-up sinuses towards the more superficial veins just under the skin. It basically acts like a siphon, relieving that internal pressure and giving the whole drainage system the nudge it needs to start flowing properly again.
And the result is this amazing 1-2 punch. First, you get the mechanical hydrodynamic effect. You're literally fixing the plumbing and restoring the flow. But second, you get the chemical neurological effect. By getting things moving, you're also flushing out all those accumulated neurotoxins, essentially cleaning up the brain's environment and letting the nervous system calm down.
Okay, so what does this look like in a real clinical protocol? And more importantly, what kind of results has it actually produced?
What's so fascinating is how precise this is. It is definitely not a one-size-fits-all treatment. For example, applying the therapy to the very top of the head targets that big superior sagittal sinus to help drain cerebral spinal fluid. Applying it near the temples targets the cavernous sinus to relieve pressure behind the eyes. Every single location has a specific anatomical target and a very clear functional goal.
And listen, this isn't just a neat theory. The clinical data we're looking at is based on a review of over 1,700 patient cases treated by Dr. Al-Jamal over a 10-year span. That's a serious amount of data.
And the impact on patients is just wow. Take people with chronic headaches. Before treatment, their average pain score was a debilitating 8.5 out of 10. After just 6 sessions, that average score dropped all the way down to 1.8. I mean, that is a life-changing reduction in pain and suffering. Ultimately, what this all points to is a massive shift in how we think about these things. For a whole class of neurological problems, maybe the answer isn't in looking for something broken, but in understanding and fixing the function of the brain's incredibly intricate support systems. And that really leaves us with a pretty profound question to think about, doesn't it? As we get better at understanding these hidden functions, like the brain's plumbing and its cleaning crews, we might just find that we're unlocking the solution to some of medicine's oldest and most stubborn mysteries.